welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, today we will be discussing about an issue that is commonly found in every household and which is most likely to be present in every individual in some way or the other. Dyspepsia, also known as indigestion, is a term that describes discomfort or pain in the upper abdomen, and the term refers to a group of symptoms that often include bloating, discomfort, nausea and burping. And well, viewers, to discuss on this topic, we have with us Dr. Soburrudin Ahmed, and not to waste any more time, I'll straight away move to him and talk more on the topic which we have selected today. So, Doctor, welcome to Good Life, the health show. It's a privilege to have you in our show. So today, the topic which we have taken, it is the talk of the town and it's been seen in every household, dyspepsia. Yeah. This is the medical term, so I would like you to make our viewers understand what is dyspepsia.
Basically, dyspepsia is a Latin word.
Okay.
It is form of two words, dys and pepsia. Okay. Dys means disturbed. It is difficult, and pepsia means digestion. Okay. So anything that is disturbed in the digestive system, the upper digestive system particularly, is known as dyspepsia.
Okay.
Okay. Commonly it involves the upper abdominal symptoms that is known as dyspepsia.
Okay. Okay. So this is, I'm sure the viewers must be clear now what is the term, because they must be thinking what is dyspepsia. So it's very simple, which you said just that it's an uncomfortable feeling which we get, and it's found in every household.
Obviously.
So yeah. I would like to tell you, ask you about your specialty also, doctor. Tell us something about that.
I am Dr. Soburrudin Ahmed. As you have mentioned, I am a chief consultant gastroenterologist in Hayat Super Specialty Hospital. And gastroenterology, the subject involves with the system of and the organs that is involved from the mouth, from the esophagus, that is your food pipe, the stomach, the small and large intestine, and also the gallbladder, the pancreas, and the liver. Okay. So all these organs with the disease involved with these organs are covered by gastroenterologists. And it's a very rapidly progressive branch in the field of medicine nowadays in gastroenterology, because of the development of the newer sophisticated instrument and sophisticated skill with the gastroenterology department can take care of most of the problem that were earlier taken care of by the surgeons. So without surgery, we can do a lot of the procedures nowadays, and also a lot of research has been being done in gastroenterology. Okay. So in short, this is what about gastroenterology. Okay,
so it's like there are lots of research, as you have already mentioned, and researchers will go on, and this is the topic which is very much in these days.
Obviously,
it's like I've already told you that it's found in every household, and we'll see that one or the other person is having a problem with this term. So we talked about dyspepsia. You just gave a clear brief about the topic. So are there any types of dyspepsia, doctor?
Yeah, the dyspepsia, there are basically two types of dyspepsia. We describe in medical term. One is a secondary dyspepsia, another is we call functional dyspepsia. The secondary dyspepsia, where you get a particular cause. There is a particular cause, definitive identifiable cause, that causes the symptoms of dyspepsia. If you treat the cause, the symptom may go off. Okay. So what are the causes? There may be peptic ulcer disease, there may be gastritis, there may be gastric cancer, gastric erosions. These are the causes that can cause symptoms of dyspepsia. We'll come to the symptoms of dyspepsia, of course, later on. But these are the secondary dyspepsia, where you find a definitive cause on investigation. Another term is the functional dyspepsia, where there are symptoms of dyspepsia, but on doing the investigation, there is no either any organic or any metabolic cause that can lead to the symptoms of dyspepsia. So those are known as functional dyspepsia. The functional dyspepsia, causes of functional dyspepsia may be related to some functional abnormality of the stomach. Particularly, there may be decrease in the accommodation power of the stomach. You take food, the stomach cannot accommodate a lot of food, that can cause symptoms. There may be hypersensitivity of the stomach. There may be some psychological issue of the patients. So these are the causes of functional dyspepsia, where you don't find any particular cause that can give the symptoms.
Okay. So what would be the basic cause and what would be the basic symptoms one can come out to know that the person is not feeling well? So there might be many reasons. So what would be the basic reason for this?
Yeah, the basic reason for the dyspepsia is there may be, as I have said, there are two types of dyspepsia. One may be secondary. The secondary cause is found that can cause dyspepsia, another functional. The symptom that patient come to us with the dyspepsia is basically there are 4 cardinal symptoms. One is there may be epigastric burning. Epigastric, there is upper abdomen, center of the upper abdomen, you may feel burning sensation. There may be epigastric pain. Okay. There is postprandial fullness. You take food, you take a little bit of food, you feel fullness. Okay. That is known as postprandial fullness. That is another cardinal symptom. And the 4th one is your early satiety. Early satiety means you take little amount of food, you feel, oh, I can't take any more. So that is known as early satiety. So these are the 4 cardinal symptoms usually defined in dyspepsia. Apart from that, you may also have nausea, you may also have vomiting, regurgitation, burping. These all are the symptoms which the patient will describe in the dyspepsia. However, particularly the common people, they cannot describe the terms, but they will come saying that I'm having gas. Okay, this is the common symptom.
I'm feeling well. I'm feeling full. Indigestion or something like.
Exactly. So these are the terminology patient come up with you. These are the symptoms I'm feeling. So you may think at that time that the patient might be suffering from dyspepsia.
That the medical term would any of the doctor would suggest, because when the patient comes to you, they will be telling their problems that they are feeling this or they are feeling that, and then you will be telling them or you will be guiding them and proper diagnostic will be done. So and then they will come to know, okay, they are feeling this, so this is the problem.
Okay, everybody will come with a common symptom. I am having gas, but that gas they mean different thing to different people. I as a physician have to guide them that these are your symptoms, so these are the problem you might be suffering from.
Sometimes we come to know that if you are having a lot of rich or with lots of oil, if it's there in your diet, so you might feel sometimes of indigestion, some kind of thing. But sometimes it happens that you are having a very good diet and everything is proper, less oil and then proper lifestyle, but still you have kind of a problem. So what would be the reason?
The reason is always not the spicy food or whatever you take.
So this is the thing which everybody has in their mind, that the spicy food, lots of oil, this would be the reason for gastritis, but this might not be the reason.
That is one of the causes. That may be one of the causes, but there may be different other causes as well. Patient might be having some sort of inflammation in the stomach. H. pylori is a bacteria that is very common in general population. Around 80% of the people have this H. pylori infection. That may cause trouble in your stomach, that can cause dyspepsia. Even if you take a normal diet, that may be the cause. In functional dyspepsia, even if you take normal diet, your stomach is hypersensitive, your stomach's accommodation is disturbed, then also causes dyspeptic symptoms. Particularly in diabetic patients, they are having postprandial fullness very often because their stomach cannot function properly. So these are the causes. Patient may feel dyspepsia. Even usually the patient say, doctor, I am having normal diet, I am having regular meal, but still I am having symptoms. These may be the causes.
Okay, so there are some of the people which I have also found out and had a word with them. So they also always complain that they are having a proper lifestyle, everything is good with them. But sometimes what happens, indigestion kind of feeling comes to them. And it happens when, suppose there is a gap of food habits, isn't it? Suppose you had your lunch quite a long back and then you have a very good gap and then you are having a dinner at night. So is the gapping system also very important, playing an important role?
Exactly, it's very important because your digestive system is like that. Your stomach is empty every 5 to 6 hours. Whenever you take food, every 5 to 6 hours, the stomach gets empty. So if the stomach gets empty for a lot of time, the acid that is produced in the stomach, there is nothing to digest. That can cause trouble. So you should have a frequent small meal. Frequent small meal every 4 or 6 hours. You should have something so that your dyspeptic symptom decreases. Okay, and also there are a lot of, as I have said, there is food habit also can cause your dyspeptic symptom. A lot of chocolates, spicy food, tomato-based products, carbonated beverages, all these can cause symptoms.
Okay. And suppose and this thing is very much seen in the office goers and the ones who are in office, because they are always with the work pressure and they are always with their work. So they don't find time to have proper meal times and they couldn't take out time. So in that case, what happens, a lot of gap has been seen in their eating time. So what that person can do, as you have mentioned about the small meals, if suppose they have to have some small meals, so what kind of food they can have with them and chunk out?
Yeah, that is the thing. One is you have to take small frequent meal. You have to avoid the things I have said. You have to avoid the chocolate, the peppermints, then your carbonated beverages, tomato-based products. These are the food usually have to avoid it. You have to change your lifestyle, particularly you are smoking, you have to avoid smoking, you have to modernize or at least stop or modernize alcohol. This is the precaution a person can take care of.
And if we talk about the main cause of dyspepsia, so what could be the main cause and how can people think about it and they can change their...
Yeah, the main cause, there is, I can say there is not a single cause.
There is no single cause.
One is if it's a secondary dyspepsia, there may be peptic ulcer, there may be gastritis, there may be a S. pylori infection. The person may be having, if any person takes painkiller medicine regularly, they can have problems.
Oh, so that is also one more reason.
Yeah, this is a very common problem. Usually, a person takes painkiller medicine for this and that, that for a long time, if you take the painkiller medicine, that can cause the dyspeptic symptoms. And the another group is functional dyspepsia, where usually you don't find a proper cause.
Okay, okay. And what about the pills, like the ones they are facing gastritis and they are having those pills? So are they safe or is there any kind of side effects?
Yeah,
because at that point in time, people feel that they must be cured, so they have those pills.
Very good question you have asked, actually. The pills that we have, you are taking, usually we use the acid suppression medicine, that is proton pump inhibitor, what you call. It's usually very safe medicine. It doesn't cause much a problem, but very long time use may cause small problems like it may cause your bone mineral density may be reduced.
Okay.
There may be some sort of electrolyte imbalance. In long term use, it may cause some vitamin B12 deficiency also, and some sort of small gastric polyps. But these are not a very major problem.
Okay, okay.
But anyway, once you can often see the patient comes to you that I have been prescribed by some doctors in a gastric medicine, and I am continuously taking for so many years, but nobody has asked them to stop the medicine. So there should be a proper de-escalation method of this medicine. Okay. Once you start medicine, you are taking for a long time, suddenly one day you stop the medicine, your symptom will definitely recur. So there should be a proper way to gradually de-escalate the medicine so that one day
one should not stop immediately.
Yeah, like before stopping the medicine, you consult a doctor, and the doctor also, not that you take this medicine for a month and come back 1 month. There should be a proper way to discontinue.
Okay, and there should be a proper checkup also. What kind of what is the situation of that patient? If it is like better than before, then the medicines can be changed, or if they have to stop also, what is the procedure that can be done slowly and smoothly, isn't it?
Exactly.
And if the patient is having that medicines, which is the better time to have that? Is it like before the food, empty stomach, or?
Yeah, usually the proton pump inhibitor that we most commonly use nowadays is taken around half an hour before the meal.
Okay.
Morning before breakfast, taken half an hour before the meal. Another group of medicine is also there, which is known as ACE2 blocker, ranitidine group of medicine. That is usually taken after meal.
Okay, okay. And if we talk about the remedials at home itself, if we are not aware of the medicines or pills and suddenly someone is not feeling well after suppose having a dinner, a heavy dinner somewhere in a party or something like that, and the person is not feeling well, indigestion kind of thing is coming up. So what are the tips you can give it to them to have a
usually better not to have that type of food. You have to take the precaution before taking this.
It depends upon the individuals actually.
Yeah, and one should take a lot of fluid, a lot of water, a lot of fluid should be taken along with the meal, and particularly to avoid a lot of spices. That is the way you have to take care of the problem. Yeah.
And if we talk about the risk factors of dyspepsia, is there any risk factor, doctor?
Yeah, obviously there are some risk factors of the dyspepsia, particularly the younger people. They are more prone to having dyspepsia. Office goers, as you have said, they have a lot of
junk foods
gap
outside
with the meal, junk foods. They are having the chances of dyspepsia more, and also the intestinal system is very emotional organ. Anything upsets your mind, it can get disturbed. So person having anxiety, person having depression, person having sleep disturbances, that can precipitate your symptoms. So these are the risk factors, and also, as I have said, the patient who are taking regular painkiller medications then can also having the dyspepsia. These are the common risk factors that can precipitate dyspepsia.
So the health factor is not only about the food, what we are having, it's also related to our mind.
Obviously.
If you are not well, or if you are very much depressed with something, then that it creates Dyspepsia. Okay, this is also one kind of reason. So which is like our viewers must be unknown, and now I'm sure that you must be clear that it's not only about your food, because if suppose you're thinking that I'm having a proper diet and why I'm facing these kind of problem, but your reasons might be something else. If you are depressed a lot and if something is flunking your mind, then that might also be a reason, isn't it, doctor?
Exactly.
Okay. So, doctor, if we talk about, because we are talking about dyspepsia, but I have taken another topic, that is, what is GERD? So, if our viewers can have a knowledge about that.
Yeah, GERD is also a very common day-to-day problem.
So, is it related to dyspepsia?
Yeah, it is something related to dyspepsia. Okay. It's a similar kind of thing. GERD means gastroesophageal reflux disease. Okay. That is, your stomach content reflux back into your esophagus, causing symptoms is known as GERD. Now, GER, that is gastroesophageal reflux, is a normal physiological phenomenon. Okay, you are taking food, some amount of air goes into your stomach, that has to be vented out. Normally, it happens. Okay. Now, when this normal things causes problem in your esophagus, that is food fibre, that is known as GERD. Gastroesophageal reflux disease. Now, why it happens? Okay, normally we have a sphincter, that is a tight sphincter between the stomach and the esophagus, which remains closed. When you take food, it opens, the food goes inside, it again closed. So, whenever you need to burp out, it temporarily relaxes. Okay. Now, any causes that causes permanent relaxation of the sphincter, the stomach content will automatically come up into the esophagus. The stomach content contains acid, it contains pepsin, that will damage the esophageal, that is food fibre mucosa, that will cause your symptoms. This is known as GERD.
Okay.
This is the main pathophysiology, how the GERD occurs.
So that pipe remains closed every time, and if suppose some person is like having a lot of like gastritis, so is it like necessary the pipe sometimes open up and and the person feels every time that it's like the stomach is full and the person doesn't want to have anything.
Exactly. So anything that causes relaxation, if your the sphincter, particularly the chocolatey products, the tomato-based products, whatever I have already mentioned, they usually causes relaxation of your lower esophageal sphincter. That may causes regurgitation of the food into the esophagus, giving rise to the GERD symptoms.
Okay. So this is what can one person do if suppose this kind of problem is being faced by someone?
Okay. So basically when we find the GERD symptoms, we have to take care of 2 or 3 things. Particularly, you have to change your lifestyle. So lifestyle comes 2 things. One is your food products, diet, that the medicine, the product I have already mentioned, you should avoid as much as possible. And another is your lifestyle modification. Lifestyle modification, few things comes in lifestyle modification. Particularly, you have to lose your weight. Patients who are very heavy, overweight, they are frequently having the GERD symptoms. So weight loss is a very important issue in relieving GERD. And also, you need to stop your smoking. If you are taking, you need to stop your alcohol you are taking. And there are few tips to reduce the symptoms, particularly when you are, you should not go to the bed immediately after taking a heavy meal. Okay, if you go to the bed immediately after taking a heavy meal, the stomach is already full, the food content will come up to your esophagus, will give to reduce the symptoms. And also, what you can do is, while you're sleeping, you can raise your head end of the bed a bit more, 4 to 6 inches.
It shouldn't be in the level, but a bit
inclined, so that the reflux is less.
Okay, doctor, such a good words and such a effective words you are telling. I'm sure the viewers must be effectively watching it. So, doctor, on last note, as we are short of time, so on last note, what would you like to tell the viewers out there that they shouldn't worry about whatever problems they are having, because they can come to see any of the doctor and get a better treatment about that. So, what would you like to suggest them on last note?
I will suggest that whenever you get this type of symptoms, you should not ignore it. Because I am saying this because the GERD, whatever we find is a tip of the iceberg. Most of the patients with GERD don't come to the doctor. When they get complications like your esophageal stricture, esophageal ulcer, then they only come to the doctors. So I will suggest you, whenever you get symptoms, whatever the tips I have already given, you maintain that, you maintain your lifestyle, you maintain the better food habit. If you don't get relief with lifestyle modification and food habit, should come to a doctor, should get diagnosed and treat as early as possible.
All right, and at least one can start from their home and they can start themselves, and if it is not possible for them, then any time doctors are there to have a checkup on that. Okay, thank you so much, doctor, for coming to our show. It was a privilege to have you, and I'm sure the viewers who have watched our show just now and must have benefited with the topic which we have taken today, because it was an important topic which we found in every household. And I'm sure after having a word with doctor, so he just clearly mentioned that there are lots of things one should have, and one should have a proper lifestyle, and one should keep their mind always free, and lack of depression can lead a good and happy life. Well, viewers, it's time now to slip into a short break, but do come back soon as we have lots more on the other side. But before we go, we will leave you with some amazing body facts, so take a look and enjoy.
In an adult human being, 25% of their bones are in their feet. A human's little finger contributes over 50% of the hand's strength. There are more bacteria in a human mouth than there are people in the world. Within just 3 days of dying, the enzymes that once digested a person's food will begin to digest that person's body. A human skeleton renews itself completely every 10 years. By the time a person is 70 years old, he or she will have consumed over 12,000 gallons of water. The human bone is 5 times stronger than a steel bar of the same width, but it is brittle and can fracture on impact. The taste cells in our taste buds live only for about 2 weeks. There are 10 times more bacteria in your body than human cells. Like fingerprints, each human tongue has its own unique print. Every hour, humans shed about 600,000 particles of skin, or about 1.5 pounds every year. By the time a person is 70 years old, he or she would have lost about 105 pounds of skin.
Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. And it's time now to move on to a subject which plays a very crucial role in our lives. In order for our bodies to function properly and stay healthy, it is important that we follow a good nutritious diet. And today the topic which we have taken to discuss is gastrointestinal disorders. And this is a very hot topic, and to discuss we have our nutrition expert Tina Baby Borua. So Tina, once again, welcome to Good Life. And today the topic which we have taken, this is also a very talk of the town. It's seen in every household, gastritis, we can say, or gastrointestinal disorders.
Exactly.
So what is it all about? First of all, tell us.
As gastrointestinal disorders may be like constipation, then gastrointestinal disorders may be like, as already the doctor has mentioned, that GERD, that gastric reflux in the esophageal, and then ulcerative problems in the stomach, or maybe sometime like gastritis, which is a very, very common term, are all in a whole can be termed as a gastrointestinal problems. And there may be some problems like anal fissures, and it is not only seen now in adult, or a certain age is there, age factors are there, where you can specify that this age to this age people will only get.
It's with everybody.
Yeah, it's from the small children to the adult, or to the elderly people we have come across with these problems. And these are the factors which is responsible for gastrointestinal disorders, or the problems are mainly your lifestyle pattern, how you eat and how you lead your life. These are the two important things. Number one is that if you have too much of meal gap, morning you have not taken your proper breakfast, and directly you have taken your lunch, or you have not taken any small snacks in between. So it may lead to your gastric reflux will be more, and that may lead to gastric ulcer or certain kinds of disorders. And if your diet is not full of or lack of, you know, high fiber things, then that may also causes disorders, certain disorders like constipations, or sometimes it may lead to gastritis problems also. If you are taking too much of refined foods, like it may be of maida products, or it may be of too much of consuming bakery items in the empty stomach. So that may also causes certain kinds of you know, stomach related problems. And if your diet is full of fatty foods, and mostly we have seen that you know, not having proper diet plan or not having proper schedule of the timing of food, so that may lead to this kind of diseases.
So these are the basic causes we can say about it, like if it is a lack of like timing and lack of like high fiber food, so these might create a lot of problem in any of the individual, isn't it? And there is no age limit these days.
Yes, there is no age limit, because we have seen in pediatric patients also I have come across, which are having or suffering from constipation or anal fissures are common nowadays. So in these terms, one has to, if it is a children, the mother or the parents has to take care of it. If it is an adult, one must educate oneself that what is the right food they have to take, and meal gapping should be reduced. You should have at least of 4 to 5 hours of interval, you should have something. But something is not like, no, whatever you get, you just have it. Like if you are having a packet of chips, or if you are having too much of chocolates or too much of caffeine, means if you are having in a whole day, if you are just on tea, or if you are having your
same kind of food,
coffee only, that may again lead to, you know, gastric problems. So you should take some healthy snacks. So it can be a bowl of like some boiled chana, or maybe you can carry some sprouts with you know, cucumber pieces and all. You can carry some fresh fruits. So that can be taken in between your meals. And this is also easy to prepare also.
Easily available, and we can carry it any time, and we can have it any time.
High fiber diet, if we say it, that your diet should be include like oats, as I always keep on telling, and then dalia, and or maybe of you know, atta, you know, red atta basically. So that this contain fiber. So those things has to include, not only just consuming too much of rice or too much of like maida made foods, you know. You should not stick to that.
So all right, Tina, so what you were telling about, like we could have like included, or what things we should avoid while having and taking a proper diet.
Exactly. You know, already someone is suffering from constipation or irritable bowel syndrome, or maybe having some other sort of gastrointestinal disorder already into it. So what are the food has to avoid? Fatty food should be avoided completely. The food products which contain caffeine, caffeine is not only, you know, present in a cup of coffee. It is we have seen some of the now products which are already coffee powder is added, like some of the smoothies or some of bakery items. So that are also
tea and coffee is not only the factor,
not only the
items
where caffeine means cocoa powder is added in more amount, you know, ample amount. So those products has to be avoided. And not of taking too much of like milk tea. Milk tea and coffee with milk for like 10 to 15 cups a day. You know, I have come across some of my patients who are, you know, habituated or are having some habit of taking only tea in a whole day,
especially in offices. These kind of like
so those habits should be switch off, and you should carry some healthy snacks, as I have already mentioned. Some small tiffin should be carried, and that should be taken in small meals, maybe a handful of nuts, maybe some of the cut fresh fruits, or some boiled chanas, or some of, you know, pancake you can prepare, and you can you know, wrap up in a tiffin. So that can be included in between of your major meals. So that will reduce your acid reflux. But one thing we have to also see, some of the patients, you know, doctor asks not to take take milk and milk product, which is a very common question. Patients coming to me, they ask that whether we can take milk and milk product.
That is a very basic question everyone comes to you and asks.
So milk and milk product, it is seen in earlier that it has been allowed for the gastric people, but nowadays doctors they say that not to take milk and milk product because some of the symptoms may it may increase more in the gastric reflux, may be more due to that, or the symptoms may aggravate in a very dangerous
and there are
way.
lots of people, they are not very much used to milk, and these lactose-free something kind of milk is also available these days in the market.
Right. So lactose-free milk can be taken, but one thing we have to again note that if whether it has some interaction with the medicines that are being prescribed by the doctor, because some drug and food interactions are also there sometimes. So because of that reason also the treating consultant may say not to take milk and milk product in terms of someone is having gastrointestinal problems. So that also has to be noted. But one thing I would like to mention, that curd or yogurt is very much beneficial because it contains probiotics. So it helps in suppressing the acid reflux, and it helps someone who is having too much of like ulcer in the stomach. It helps in curing the ulcerative syndromes.
Curd,
but the curd has to be prepared from the skim milk, not from the full fat whole milk. That has to be noted. The curd to be the skim milk, and if yogurt is available, so it is much better. And curd can be, you can prepare some of the dishes like oats can be prepared with the curd. You can mix oats and curd together, or the traditional dish of Assam, that is the sira doi, flag rice and the curd can be taken in the morning. So curd will help in curing your ulcer. Curd will also help in suppressing the acid reflux. So it has much beneficial effect in the irritable bowel syndrome also, and also it helps in curing the constipation too. And we have also seen some of the patients coming to me having constipation problem, which is a very common. It is also one of the gastrointestinal disorder. So constipation is mostly due to your wrong meal pattern, or maybe you are suppressing or resisting yourself from not passing the stool, which is very common in the children and the young adults, or not clearing up your bowel properly. So it may lead to, in a long run, it may lead to constipation. And in pregnancy also we have seen that some of the women are complaining about the constipation. So the main thing is that in constipation you have to take lots of fluid, and you should take food which contain fiber. Fiber is present, as I told you, like whole cereals. It can be oats, dalia, atta, all this type of food. And also it is also fiber is also present in dal and legumes like rajma, lubia, or chickpeas, or green moongs, or desi chana. All these things also contain fiber. Fiber, if we say, it is also present in green leafy vegetables, also like sag, or which is mostly common. But we have also noted that if somebody is taking green leafy vegetables, may have bloating problem, indigestion, or somewhat like that is noticed in irritable, digest properly in irritable bowel syndrome. So in that case, I suggest that you have to grind the green leafy vegetable, and then you make the then you prepare the curry. If you take in the form of just frying it, it may cause some problem of bloating, or not having irritability in the stomach.
Good. So one can just grind it and then
cook it. Means like you have to soak the green leafy vegetable, and after soaking you have to grind it and make a paste of it, and after in that paste you can incorporate some of the other vegetables, or you can incorporate with fish or chicken or with paneer and all. So those can be incorporated with that. But that has to be noted whether you are having some problem or not with the green leafy vegetables. And if you do not have problem, then you can take it by adding in dal, dal or fried or in a common way. And also I have come across some of the people complaining about, like, no, after taking egg they may have a bloating problem or indigestion problem. So it is mostly seen in the irritable bowel syndromes. So egg may not be the problem for all the people.
For all the people, because milk, egg, curd, it's like everyone is having their own notions and everyone has their own systems.
I want to clear it up that curd or yogurts rich in probiotics, so it doesn't cause any harm for a patient having gastritis problem or constipation. So one can take freely. But egg and milk product, that is differ from person to person. As I said, some drug the one is taking, so that may have some interaction with the milk and milk products. So the doctor may ask that not to take the milk in the form of, like, liquid milk or cheese or somewhat like that are being said. So you try to avoid that. But curd and yogurt can be taken. But next thing is that in the other side, if we say egg is not allergic to everybody. If someone is having irritability with the egg, you just avoid it. But by listening to one person, the other person should not avoid the egg. That particular person may not have any problem from the egg, but listening one to another,
and they might make their own notions. I might also have a problem, so I should stop doing that.
Taking
one should not do that, because if you have any problem, then you can do that, isn't it, Tina?
Right.
So, all right, Tina, so we had a lot of discussion on the topic. So, what are the other notions you would like to add on it?
Yeah. People asking me, like, if someone is having dal, they also have a bloating problem, whether dal or pulses also causes certain kind of bloating problem or not, or gastrointestinal disorder. So it varies. Again, I'll say it varies person to person. You may not say that somebody having masoor dal will have bloating problem, the other person may also have. But it is a suggestion that if someone is suffering from some bloating or indigestion problem after having the dal, you just soak the dal overnight and cook next day, or you cooked it properly, overcooked it, and then you consume. Because if you keep on skipping out all sort of like foods, then
just
you will,
for the sake that it will hamper your
health. You will be becoming underweight, or you may not get proper nutrition. So there are some alternative measures that has to be found out.
The psychological part plays a very important role in this, Tina, because like if you have a problem with some kind of food, you will be having that problem for the entire life. You might not change because you are thinking, you have a single cut notion that no, this food is not meant for you, or maybe you have heard from someone that this is not good for your health or something like that. But maybe that food is good for you, not for the other person. Everyone has
their own. As I said, the irritability not be, you cannot define. If somebody is having the same thing, I'll also have it. So it differs from person to person. So on the basis of the irritation, you have to avoid that particular food, but alternative has to be taken care. If somebody is having problem from the egg, I said, but from where the person will get the calcium, that also has to be marked, because if they are not taking calcium rich food, then they may be having bone problem on later part of the life. So that has, the alternative should be given. So that so that has to be seen, And I have come across one patient which I would like to, it's very interesting case which I say in my all the episodes. A lady came to our hospital, that is Excel Care. So she feel like, after eating every meal, she feel like vomiting. So it was been a notion to her. So then I discussed with the doctor. Then he suggested me that you give small meals at frequent interval. So I start to give every second hourly small snacks to her, but still she has that problem of nausea or vomiting. So it made me tense that what is wrong going on, because the foods which has to be given in gastritis or which has to be avoided, complete list has been made and given to her, but still why it is happening. Then I again discussed with the doctor. Then he said me that it is a completely psychological problem to her, because she feel like after taking the meal, bloating or vomiting. So you give some alternative thing to her. Then I thought on this matter, then I started giving her Nestum, which is a baby food. Then I told her that Nestum is not a harmful thing, it's a baby food. So whenever you feel like bloating or whenever you feel like the nausea or vomiting feeling, you just stir 2 teaspoons of Nestum in a bowl of water, and then you have it. How you feel, then you tell to me. Then I started giving that treatment to her. Then after 1 or 2 days, she said that I am feeling good now.
This is just all about your mind.
Yeah, right. This is all about the mindset.
Because she felt that the Nestum is for babies and babies can never have harmful things. So this is one kind of like thing that everyone will be okay. So she was like all fine.
All fine. Because we all became, in one point of time, why we are not able to cure the person.
Yeah, this is just kind of notion, Tina, that every patient or any kind of like person comes to you and they have this psychological problem, though I'm facing this problem because of this. Maybe they are not facing this problem because of this. There might be some other reasons.
Some other reasons, yeah. That proper reasons has to be found out.
That's what.
With the help of the treating physician, and the dietitians are always there to make a complete list of the foods which may be causing the particular person irritation in the stomach. But in gastrointestinal disorder, it is always been said that spices should be avoided. But I would also like to add that spices like turmeric powder or like garlic or ginger and onion in little amount one can take, because it is also plays an antioxidant role. So if you completely avoid these spices, you will be depriving yourself from antioxidant. So that can be added, but you should not add chili powder or mix masala kind of spices, or you should not add like this red chili flakes, or you should not add peppermints. Those should not be added while preparing, and cooking time has to be maintained, because you have seen some in the household who cooks for a prolonged time, like dry fried crispy, mouthful of water kind of
proper
things.
Timing should be given. It shouldn't be cooked over. It shouldn't be overcooked
or dry fried food should be completely avoided with lots of chili powder.
That can be done for like 1 or 2 days in a month, but not every day, isn't it?
Exactly. But already who is having some ulcerative problem, it is better to avoid. Better to avoid. And acidic foods, like it may be tomato or tomato based food, canned foods, and like citrus fruits. It can be like juices or oranges. So those are citrus. So those fruits or fruit juices should be avoided if someone is having.
There are many things, Tina, that one can avoid and one can add to their diet, isn't it? So I'm sure the viewers who must be watching our show must be thinking that Tina is telling so many things about food items, how to balance everything, but I'm sure if you take out time, if you take out a proper diet chart, and if you think that I need to have a healthy life, then you have to go with the flow and you have to have a proper diet, as just Tina has mentioned about the proper food habits, the things which you can get easily and you can have easily at any time of your time and just lead a happy and a healthy life out there. So thank you, Tina, for coming to our show and giving us such valuable time and making us understand on the tips and what can we do at staying at home itself. And I'm sure the viewers must have also benefited out of that. So on that note, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. Well, viewers, emergency situations in life are always unpredictable. That poses an immediate risk to health and life, for which one has to take proper care of their health. So, viewers, today we will take you to Excel Care Hospital, which is known for the best treatment it provides to the people in emergency department. So, let's have a look at what the hospital has to offer. Emergency's life is inevitable. And when it comes to emergency of health issues, it is also very crucial. A patient treated the fast and the best in the emergency can have the fastest recovery. Today, we will take you to the Excel Care Hospital, which is known for the best treatment it provides to the people in the emergency department. Immediately after the patient arrives in the emergency department, the specialized team of doctors categorizes them into triage 1, 2 and 3, and the doctors try to give the treatment accordingly.
Now we are at Excel Care Hospital and we have with us Dr. Debanga Bora, who is the in charge of the emergency department of Excel Care Hospital. So doctor, so how it all happens, this procedure in the emergency department of Excel Care?
This is the emergency department triage, or this is the reception, where first the patient attendant will contact with the reception persons. So whenever there is any casualty or any emergency comes, the patients will come through this door and they go straight forward to that room that is called the triage one. And our wheelchairs and stretchers are available every time here. So people are here who carry from this door to that door. So we have an emergency calling bell in our hospital. This is the emergency calling bell. Whenever there is a serious patient come to the emergency department, so we'll just push it up, then all emergencies will be alert. And everyone is in emergency department become alert, and they will come rush, or they will, if somewhere else also, they will directly come to the emergency department.
The most serious patients are shifted to triage 1, where they are given special treatment and care by the doctors. For the patients in the triage 2 and 3, who can be treated with some time, are counselled by the team of nurses and the PRO and told what treatment they can move forward with.
This is the triage area. We'll examine the patient here. First of all, whatever the patient, we'll examine here. You will see which patient is serious, which patient is not. So if the patient is serious, or something need urgent treatment, or urgent something like very serious condition, then we directly take him to our next door, that is called resuscitation area or triage 2 area. Is again come with the triaging. So first triaging is triage 3 people. They need counseling in the later stage. Means we have to go through all the investigations. Like simple example, the person coming with a pain abdomen, then we'll give him medicines, he'll get relief. We'll ask him to do the ultrasonography. After doing the ultrasonography shows there is a gallbladder stone. So we can give him a counseling after 3 to 4 hours also. That you have a gallbladder stone, you just go and check with your surgeons. Okay, fine. Next triage is person is coming with a fracture. So now we cannot, we have to go for directly investigation first. We have to show him immediately the X-ray. See, this is the X-ray, and you had a fracture. Now you have to be operated, or you have to go for this type of treatment. So this is a different type of counseling. Third is, it's up to him. He may go to this, and he may not.
It's his choice.
His choice. And third is yours is the very serious. Is very serious, his patient is unconscious. The patient himself knows that the patient is very serious. We'll immediately will do the CPR. There is the counseling is little bit late. But at that moment, the co-staff, like I say, sisters, our PRO, they used to counseling them parallelly.
The emergency department of the hospital also has the one-of-its-kind minor operation theatre for the triage 1 patients, so that they don't have to wait and the surgeries can be done at the soonest.
And I can show you, we have one minor OT also here in our department.
Emergency department.
It is very good, and it is spacious, and we can go for immediately. It's helps in the. This is the OT here. This is the OT here. So we can go for delivery also. If there is any quick delivery, if there is a need of any urgent surgery, we'll do immediately here.
Being a super specialty hospital, the hospital provides special discount to the economically poor people so that they too can have access to super specialty features of the hospital.
Whenever the attendant come, if they are financially poor, we'll give we'll top our all surgeries and we'll send them to the GMCH or other hospital where the attendant wants. And next thing is that we have a very I like to salute our government. There is a one very good scheme is Atal Amrit Abhiyan. Under Atal Amrit Abhiyan in our hospital, there are lots of operations are going on without any cost, without zero cost. The patients are coming here with the problem and they walk out with operation done without any zero cost. They mostly give up to 2 lakhs.
With camera person Binoy, Priti Priyadarshini reporting for Northeast Live. All right, with this we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, please do let us know by emailing us at goodlifeanylife@gmail.com. And you can also WhatsApp us on our WhatsApp number, which is flashing on your television screens, viewers. So till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.